ನಮಸ್ತೆ, ನನ್ನ ಹೆಸರು ಪಾವನ. ನಾನು ಕೋಲಾರದ ವಾನರಾಸಿ ಗ್ರಾಮದ ಮಹಿಳೆ. ನಾವು ರೈತ ಕುಟುಂಬಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟವರು. ನಮಗೆ 8 ದನಗಳಿದೆ. ದನಗಳಿಗೆ ಮೇವು ಕಟ್ ಮಾಡೋ ಚಾಪ್ ಕಟ್ರು ಮಿಷಿನಲ್ಲಿ ಮೇವು ಕಟ್ ಮಾಡುವಾಗ ನಾನು ಕರೆಂಟ್ ಪ್ರಾಬ್ಲಮ್ ಆಗಿ ನನ್ನ ಮುಂಗೈ ಪೂರ್ತಿಯಾಗಿ ಕಟ್ಟಾಗಿತ್ತು. ಅಲ್ಲಿನೇ ಕೋಲಾರದ ಸ್ಥಳೀಯ ಆಸ್ಪತ್ರೆಗೆ ಹೋದಾಗ ಇಲ್ಲಿ ಕಷ್ಟ ಆಗುತ್ತೆ, ತಕ್ಷಣ HOSMAT ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಹೋಗಿ ಅಂತ ಹೇಳಿದರು. ತಕ್ಷಣ ನಾವು ಇಲ್ಲಿಗೆ ಬಂದಾಗ ಡಾಕ್ಟರ್ ಕಣ್ಣನ್ ಕುಮಾರ್ ಮತ್ತು ಡಾಕ್ಟರ್ ವಿಠಲ್ ಅವರಿಂದ ನನಗೆ ಆಪರೇಷನ್ ಆಗಿ ನಾನಿವಾಗ ಆರೋಗ್ಯವಾಗಿದ್ದೀನಿ.
My name is Dr. Kannan Kumar. I'm a hand and microvascular surgeon at HOSMAT Hospitals. This talk is mainly regarding the recent case that we did. So we had a patient named Mrs. Pavana. She was a 37-year-old female who was working in her field, and unfortunately her hand got caught and she had a complete amputation of her wrist on the 1st of January. And one of my friends, colleagues in Kolar, immediately gave us a call and told us that he is sending this patient here. So we kept everything ready for her to come. She came here within 3 hours of the injury. So me and Dr. Vithal, he's a plastic and reconstructive surgeon, both of us assessed the patient, and then we decided that because this is a major amputation and it was the right hand, so we decided to go ahead with what is called as a reimplantation. So reimplantation is basically trying to attach the hand, and if we know hand is made of a lot of structures including bone, tendons, nerves, arteries and veins. So we have to fix the bone, number one. We have to repair the tendons, we have to repair the artery which gives the blood flow to the hand, and then we have to repair the veins as well. So we did all this under what is called as a microscope. The surgery takes about 6 to 8 hours, took about 6 to 8 hours, and we were successfully able to reattach the hand to the patient. And now she's doing really well. She requires a small operation she has a little bit of a skin loss. To cover the skin, she requires a small procedure. So basically we want to highlight that we regularly do these kind of operations in HOSMAT. We do about 5 to 6 of these every month. This one was a more dramatic amputation, complete at the level of the wrist. And of course we have to have safety measures for such patients, and their work atmosphere has to be made more safety and friendly. Whenever we are transporting such amputated parts, it is in fact important to make sure that the part is wrapped in a gauze piece and it is put in a polythene cover, and that polythene cover should be kept in a bag of ice. And it is very important that we should not keep the cut part directly in contact with the ice. This is the most important point with regards to transporting the amputated part. Any part that comes to us within 6 to 8 hours is the right time, and we can ideally reimplant or reattach these parts successfully. Of course, we may not be able to reattach all injuries and all parts. Our success rates are as close to 70 to 90%. And I hope this message reaches out to the public, and we can save as many limbs and fingers and foot as possible if they are brought in timely and in the appropriate mode of transport.
I am Dr. Vithal Malmande, Plastic and Reconstructive Surgeon working in HOSMAT Hospital. The purpose of this talk is to basically make you people aware about the safety measures of operating these machines. We believe in the principle of prevention is better than cure. So I am going to highlight the few points which I think that must be given utmost importance when you operate this kind of a machine. So these grass cutting machines are basically having few safety measures, and government also is taking a lot of efforts to make sure that these machines are safe. But sometimes and somehow we people ignore these things and land up in such accidents. So this machine, as an engineering part of it, these come with a lot of safety designs. So they are designed so that you are not getting injured. There is a guard there which don't allow the hand to slip in very easily. The second thing is these equipments, the power equipments, because they are manual also. These power equipments, they do come with a auto cut off, auto power off kind of a thing, where these machines just switch off if something like this happens. The next important thing is education. We have to make sure that we educate these people who are going to operate the machines and how to operate these machines and what safety things have to be taken into consideration. And they also have to understand the machine and know regarding the machine. So this is also very important. And the last part is actually to encourage these people to follow these safety concerns in a continuous and a constant manner. No, there should not be any lapse in following these safety concerns. So coming to the safety measures per se, we have to understand that this grass cutting machine is basically used in villages. So these are usually installed in the farms or in the backyard of their houses. So these machines needs to be fenced properly. It's not for the people who are going to operate, but also people in the surrounding or children who are playing in a nearby area should not come and operate these machines and get injured, or accidents do happen in such manner. So that is very important. It has to be fenced properly. Then the second thing is the people who are going to operate. So we should know that people who are fit to operate these machines are only people who are operating, and not someone who are children or adults or very elderly people, or people who are having medical conditions like epilepsy, seizures, or someone who has blackouts. So these people, what happens is they can land up in a problem or accidents. The next important thing is that these do come with protective gears, like gloves, or there is a guard which protects the accident slippage of your hand. And then a few machines do have these eye protections and all that. So these needs to be aware, and these needs to be worn when the people who are operating these machines so that they protect themselves. Then the last important part of these is the maintenance. The most of the people, they ignore this maintenance. So the maintenance of the machine is as important as anything else. So you have to have a proper maintenance of these machines, and also you have to check for the safety of these machines, because if you do not have the safety inspections, then the accident is waiting to happen. So this is what I wanted to highlight in this small talk, and I hope that this is very informative to people, and be safe. Thank you so much.